Hi, my name is Lisa Wynne and I am the Parkinson's Disease Nurse Specialist with Parkinson's Association Ireland. So I just wanted to give you a little bit of background as to who I am and the services that the nurse provides for Parkinson's Association for members and carers. So I qualified in general nursing in a large teaching hospital in Dublin in 2007, where I worked for 3 years, and then I took the path of paediatric nursing in Crumlin Hospital, where I worked for 2 to 3 years before coming back to general nursing within a community healthcare setting, where I provided home visits to patients who were prescribed medication for various arthritis, gastroenterology diseases, oncology medication. And this would be medication management and education within the home to avoid readmission to hospital or having patients to spend longer in hospital. I then got the opportunity to train in an advanced Parkinson's treatment within this company, and I worked then for 7 years for this Parkinson's treatment before moving to the Parkinson's Association of Ireland in November last year. So some of the services available from the nurse for Parkinson's Association members and was a support line. So you can contact me on the support line and we'll arrange a call back for you. Nurse-led clinics. So currently I'm running nurse-led clinics on a Thursday morning at 11 o'clock on Zoom, and I picked specific topics to cover each week and then allow a time period for questions and answers afterwards. I also currently offer one-to-one Zoom calls for members of Young Parkinson's Ireland. And this is a new service, I suppose, that I'm trialing specifically for Young Parkinson's Ireland for the present time, just to see if there is an interest and to see how well it works for those members. Hopefully something I'll be able to roll out to all members within the coming months. Then obviously I'm available for branch meetings, and hopefully that's something that I'll be able to get to do soon, to get down to the branches, provide clinics, I suppose, and talk to the branches and get to meet members face to face. So points of contact that I would have vary. I would have contact with people with Parkinson's, carers of those with Parkinson's, health professionals, so that may be community health professional, multidisciplinary team members, or neurologists or nurse specialists, the volunteers at the branches, board members as well within the Parkinson's Association Ireland, and branch members and staff, and then nursing homes. So within, obviously, we have members of Parkinson's Association Ireland who are in nursing homes or residential homes. So I would have a few points of contact with either these members or with staff on various occasions. The role then of the Parkinson's nurse specialist within Parkinson's Association would involve education. So that's education for everybody. I suppose for healthcare professionals, but more for people with Parkinson's and those that care for them, and to provide support for these members and their carers. Health promotion then, so running various campaigns, running various clinics on topics specific, as I said. So this would be the development of services that I feel would be beneficial within branch level and at a nationwide level for those with Parkinson's. And then a role as an advocate. So a very important role to be an advocate for those with Parkinson's and for carers, especially as a healthcare professional myself. So some of the questions that I may get asked are around multiple issues. So it may be motor symptoms, it may be tremor, freezing, dyskinesia, or shuffle. Non-motor symptoms may be an issue for you, and that may be an issue with sleep, bladder and bowel issues, oral issues, and pain. And with regards to sleep, that could be multiple issues such as poor sleep hygiene, sleep apnea, restless leg syndrome, or insomnia. There may be more psychological issues or neuropsychiatric issues that you suffer with from a side effect of your medication or with your Parkinson's. And these may include anxiety, depression, hallucinations, apathy, and general cognitive decline. Some other questions then may be around medication management. So I'd provide a huge amount of training and education to people who ring the support line on the timing of your medication, polypharmacy. So if you take multiple medications for specific diseases or illnesses, aiming to optimize the medication that you are on. So be it that maybe a tweak in the timing, or if you require any information on advanced therapies, then I should be able to provide you with some education on this. General support and advice, I suppose it's not always a major issue that you may be ringing with. It may be just that you actually need to speak to somebody for general support. But it also may be general inquiries about Parkinson's Association and their services that we can provide, community services that are available to you. So be that public health nurse or physio or GP information. Issue or information around travel may also be something that I can advise you with and provide some tips. And then any outpatients issues that you may have, it's not that I can address the issue usually, but it's always good to have somebody to talk to about it. So the support line is open from 9 a.m. to 7 p.m. And if you ring 1-800-359-359 to arrange a call back, I will return the call within 24 hours or within 1 working day. Or you can also contact the support line to arrange a Zoom call, or contact me on the nurse@parkinsons.ie email. So I'm looking forward to getting the opportunity to meeting members, be it at branches or upcoming events, at AGMs as well. And I look forward to actually meeting people face to face rather than phone calls and over Zoom.